If you are considering LASIK, you're joining millions of people who have decided that they would like to reduce their dependence on glasses or contact lenses. You and your ophthalmologist will work together as a team so that you clearly understand how LASIK works and what you should expect from your surgery. When you talk with your doctor about LASIK, you should take as much time as you wish to make your decision before signing the informed consent forms. Just remember, as with any surgical procedure, you should have your questions answered before agreeing to have the surgery. Now, let's discuss some of the important things you should understand about LASIK. LASIK is a surgical alternative for correcting nearsightedness, farsightedness, and astigmatism. With LASIK, a microkeratome or laser is used to create a thin flap in the cornea. The flap is then opened like the page of a book to expose tissue just below the cornea's surface. Next, an excimer laser is used to reshape the cornea to reduce or eliminate refractive errors. Finally, the flap is returned to its original position, where it heals in its natural position. If you decide not to have LASIK, there are other methods of correcting your vision. These alternatives include eyeglasses, contact lenses, and other refractive surgical procedures. Remember, LASIK is an elective procedure. There is no emergency condition or other reason that requires or demands that you have it performed. You could continue wearing contact lenses or glasses and have adequate visual acuity. LASIK is a common procedure performed successfully on millions of people each year. But as with any surgery, there are risks associated with LASIK. Let's talk about some of these risks. After LASIK, you may experience glare, increased sensitivity to light, or fluctuations in sharpness of vision. Now, these conditions may or may not be related to the size of your pupil. They usually occur during a normal stabilization period of 1 to 3 months, but they may also be permanent. You could also notice a starbursting or halo effect around lights. This condition usually diminishes with time, but could be permanent. Also, your vision may not seem as sharp at night as during the day, and you may need to wear glasses at night. There is an increased risk of having dry eye following the LASIK procedure. This may be temporary or, on rare occasions, permanent, and you may need to use artificial tears, or you might need to have the tear duct openings in the eyelid closed. Overcorrection or undercorrection could occur with the LASIK procedure, causing farsightedness, nearsightedness, or astigmatism. If you currently need reading glasses, you may need them after having LASIK. You should understand that the visual correction that you can expect to gain from LASIK may not be perfect. For instance, there is the possibility that you might not get a full correction from the LASIK procedure, which may require future retreatment procedures, such as more laser treatment or the use of glasses or contact lenses. Also, the effect you gain from LASIK could regress, and your vision may go back to a level that may require you to wear glasses or contact lenses to see clearly. After having LASIK, your treated eye may be more vulnerable to injury from an impact, which could cause the flap to dislodge. You should wear protective eyewear when playing sports or whenever there is the possibility of having something hit your eye. The use of a microkeratome carries its own unique risks. For instance, the microkeratome could malfunction, requiring the LASIK procedure to be stopped before it has been completed. There is also a risk that in using the microkeratome, the flap incisions could result in an incomplete flap or a flap that is too thin. If this happens, it is likely that the laser part of the procedure will have to be postponed until the cornea has a chance to heal sufficiently to try to create the flap again. Also, irregular healing of the flap could result in a distorted cornea. Depending on the type of complication with the flap or the incision, risks could range from partial vision problems to loss of best corrected vision. After LASIK, mild or severe infection could occur. Mild infection can usually be treated with antibiotics. Rarely, severe infection, even if successfully treated with antibiotics, could lead to permanent scarring and loss of vision that may require corrective laser surgery or even a corneal transplant. Other very rare complications include, but are not limited to, perforation of the cornea, swelling or thinning of the cornea, the appearance of floaters and retinal detachment, hemorrhage, blockage of an artery or vein in the eye, cataract formation, or partial or complete loss of vision in the affected eye. It's also important to be aware that the long-term effects of LASIK are not known. You and your doctor should discuss your expectations for vision after LASIK. Be prepared to discuss what role vision plays in all areas of your life. Remember, LASIK is an elected procedure. Depending on your vision needs and desires, it may be better to continue using glasses or contacts. You and your doctor can discuss this further. While the outcome in the overwhelming majority of LASIK procedures is excellent, it's important to remember that the results of any type of surgery cannot be guaranteed. Although it's impossible for your doctor to inform you of every potential complication that may occur with LASIK, he or she will aim to answer all your questions to your satisfaction.